Hello, it's Dr. Mandy, and I'm here to talk to you about a very important finding that I have come across about one of the root causes of bladder pain and IC. Recently, I've been getting a lot more patients who are having bladder pain and IC symptoms who've never had bladder troubles before. And one thing I'm noticing that they all have in common is all of them have noticed that their bladder pain started after they got COVID. And I think I figured out what's provoking this. Oxidative stress. As you can see in this image, the infection induces a cytokine storm, which then provokes reactive oxygen species, also known as free radicals. When these free radicals overwhelm your system, you have what's known as oxidative stress. Oxidative stress is a condition that reflects an imbalance between increased production of these reactive oxygen species and an inability of your system or your body to detoxify them using antioxidants and other mechanisms to repair the resulting damage. And as you can see, this can be a big problem for people on this side of the diagram. But let me get into why I think this is related to oxalates. About 60 to 80% of total plasma and urinary oxalate excretion comes from endogenous production, and one pathway is from glyoxalate or Glyoxal. Glyoxal is derived from oxidative stress in the form of lipid peroxidation, remember that term, and protein glycation. See, under normal circumstances, glyoxalate can be converted to glycine via the AGT or GRHPR enzyme using B6 as a cofactor. To understand what's going on, you have to understand the biochemistry behind this. Under normal circumstances, glyoxalate is converted to glycine via the AGT or alanine glyoxalate aminotransferase enzyme using vitamin B6 as a cofactor. I should also mention that when Glyoxal is converted to glyoxalate, it also uses glutathione as a cofactor. Another enzyme is this one here, GRHPR, glyoxalate reductase hydroxypyruvic reductase, is often linked to vitamin B1, but also magnesium and also B6. So higher levels of oxidative stress can cause higher levels of glyoxal, which then can be converted to this glyoxalate for excretion using up your glutathione. So what are some of the things you need for glutathione? So you're basically depleting all of these necessary components of glutathione synthesis. On the one end, some of these are used so that your body can make more glutathione to deal with all this oxidative stress coming in. But on the other hand, these nutrients like B6, for example, are used as a cofactor to convert glycolic to glycine. And the more oxidative stress you have, the more this is being manufactured. So over time, you become more and more depleted of B6 and subsequently glutathione. And this becomes a vicious cycle. As you can see where I highlighted in this journal, glutathione depletion increases oxalate formation from Glyoxal. And there's a link to this as well as diabetes, peroxidation, and sugar metabolism. To make matters worse, oxalates also can promote the inflammasome, which can then increase more oxidative stress and use up those necessary nutrients, again, magnesium, B6, B1, amongst others, such as zinc, for example, that are all necessary for all these processes. So who's at risk for this? Those with low levels of baseline glutathione. And that goes along with people who have low levels of magnesium and also riboflavin. Forgot to mention that one too. That's involved in glutathione synthesis. And of course, vitamin B6, and those with low sulfur levels as well. All of these are playing a part in your antioxidant defenses. And as you can see in this image, there's other things such as your age, your current health, glutathione intake, and your lifestyle, as well as your gender, that can also determine your glutathione status. That's why I love the NutriEval test so much. It can provide so many clues as to which oxalate metabolites you're burdened with, which nutrients you're deficient in, as well as what's going on with your metabolism. So for example, there's these malabsorption dysbiosis marker. All of them play a part in your endogenous oxalate and also exogenous oxalate production. They have oxalate markers on the test, the two metabolites for endogenous as well as the oxalic acid. All of this will provide clues as well as your creatinine. Also your antioxidants such as glutathione and CoQ10 and your lipid peroxidation as well. All of these are involved in this pathology. There's also energy metabolism to identify if you're using energy appropriately. Do you have mitochondrial dysfunction? As well as toxin and detoxification markers. Are you toxic and are you detoxifying appropriately? What about your fats? Are you using your fats appropriately? Are you eating enough omega-3 and omega-6s, 9s? And what are the ratios? And how's that playing a part in your health? And the toxic elements and nutrient elements tie in really nicely with the hair tissue mineral analysis and the iodine 24-hour quantitative. All of these together can provide a very nice snapshot on what's going on inside your body. For example, are you burdened with metals such as lead, mercury, arsenic, or cadmium? What about your nutrient elements? Do you have copper toxicity? Is there an imbalance between copper and zinc? What's your selenium? How's your manganese, magnesium, and potassium? All of these minerals play a part in this entire process with oxalates and hyperoxaluria and all the symptoms associated with it, which is one of the reasons why this is my #1 go-to test. Hopefully, I've been able to help you understand the role oxidative stress, your glutathione status, and your nutrition play a role in your oxalate-related pain.